welcome to All Things Home Care with Dana Arnone. I'm your host, Dana Arnone, a registered nurse with over 30 years of healthcare experience. In today's show, we focus on physical therapy for the older adults. First, we go out and about to see the benefits of an in-home physical therapy session. Then we meet an 80-year-old energetic Dolores who credits physical therapy as a key part to maintaining her active lifestyle. And Dolores still works full-time. In our Ask Dana segment, I answer your most pressing questions. And then finally, we wrap up our show with a tour of Farmingdale Physical Therapy West. So let's get the show started by taking you out and about for an at-home physical therapy session. Hi, you're out and about with Dana today. We're in Massapequa at this beautiful home. We're about to go inside to watch a physical therapy session with a dementia patient. We're going to go through all the things that a physical therapist would look for that in your home. So let's go inside and meet the family. Hi, Sean.
Hey, Dana.
How are you?
Good.
I'm so happy you let us come to your home today. You know, it's very important to us at All Things Home Care that we show viewers exactly what physical therapy is, what someone's house looks like. So to have the opportunity to see Dorothy, your mom, and her therapist work together, it's going to help so many viewers. So why don't we go inside and meet your physical therapist?
Absolutely. This is John, one of our physical therapists.
So you're Dorothy's physical therapist.
Yes, I am.
When you come to a patient's home, what is it that you look for as a safety or just as a home evaluation prior to the first meeting of physical therapy?
When I first come into a home, I look at any kind of hazard that patient may fall. Then we would assess the patient, their strength, their range of motion, what they can and cannot do, and then what they can do, and we see if they need any help with that, whether the aide helps them or a family member helps them.
In the situation of Dorothy, she has dementia.
Yes.
So we're going to go inside and meet Dorothy, and then maybe take us through some exercises and some programs that you do with her on a daily basis.
Sure. Hi, Dorothy. How are you? Yeah? Good. Let's start with some stretching for your legs, okay? Like we usually do.
So the stretching and the massaging is to help with what?
Just helps with the blood flow, loosens up the musculature, helps her to be more nimble. And when we go for our walk later, her legs are a little bit looser. So we just do just a simple calf and hamstring stretch for her, just to keep everything limber. And then we'll do some manual leg press, and this is going to work the muscles in her quads and strengthening. Dorothy, can you push into my hand? Push. Come on, push. Good. And then go back. Then relax your leg. Push again. Push, push. Good. Let's do 5. Come on, push. Push. One more. Good. And we would do that on both legs just to get equal strength. And then we'll do some kicks. Can you kick out for me? Oop, go ahead. Good. Nice and slow, nice and slow.
So are these some things that you would be able to teach her caregiver to
Yes.
do? So even the massaging of her lower leg, that's something that a home health aide can do?
Yes, absolutely. Home health aide, family members, husbands, sons, anyone can do this with the patient.
And that should be done daily?
Yes, and I know with Dorothy here, the aide and the husband walk with her when I'm not here, the days I'm not here.
And then we stand her up?
Well, we do a lot of stuff in the chair because Dorothy's balance is not the greatest. So we do a lot of her exercises sitting, and then we stand her up, we go for a walk, we come back, we take a little bit of a break, give her a little rest, and then we do another walk with some exercises in between.
And her treatment lasts for about how long?
About 45 minutes to an hour I'm here.
Okay. And you're going to be walking around the house?
Yeah, we usually walk out the doorway here, around the dining room table, and come back to the chair. We have to use the rocker. We give her some verbal and tactile cues so she does it easier. Dorothy, put your hands in the chair here, remember?
I think the important thing that people need to know is that not everybody, everybody's chair is different.
Oh, of course,
So
yes.
this is Dorothy's chair, but
Yes.
in another person's home, it could be a completely different chair,
Right.
higher, lower.
Right.
So really knowing that person's, where they sit most of the time is very important for the physical
Yes,
therapist.
and the other thing too is not everyone needs as much help. People may need more help. Okay, lean forward. We're gonna stand up, okay? Ready? 1, 2, 3, stand up, push. Very good. Terrific.
There you go.
Okay, now grab onto the walker. Up tall. Okay, we're gonna go around the dining room table like we always do, remember? So I always have a hand close by just in case she stumbles or misses a step.
If she didn't have hardwood floors, this walking with the walker would be difficult.
Yes.
Can Dorothy do this by herself?
I wouldn't suggest it because she does need some guidance to not hit the walls with the walker or the chair. She can fall. So I would suggest she has somebody with her at all times. And I've told Sean and I've told her husband and the aide, they all know when they walk with her. Usually by the third walk, she gets tired. During the day when I'm not here, I just tell the aide, you just look at her fatigue level. If she seems tired one day from the heat or whatever may be going on with her, then I would do maybe 1 or 2, depending on. I see Dorothy twice a week. We usually watch the old movies on TV, right, Dorothy? So hopefully tomorrow there's one on TV.
The interaction with another person is so important, and just having the visitation, it can make all the difference in the world.
Just coming and talking to her sometimes. We'll sit here while she's resting, talking about the movie, and she has a smile ear to ear. She'll grab my hand, she'll caress my hand.
Keeping
And
her
that's
mind active.
Yeah, exactly.
What's the first thing that you're looking for when you go in the house? Are you looking for the throw rugs? Are you making recommendations to people how to maintain that safety in the house?
Yes, that's the first thing I would look at is throw rugs, because if those are, even for you or I, it's a safety hazard. And then if you have someone who's elderly, can't walk that well, it's even more of a risk.
And then I suppose that you create a care plan with the patient and a treatment plan, and then you go over that with the caretakers as well.
Of course.
Very good.
And if there's any kind of home exercise program like we discussed, we'll definitely utilize those and go over that with the caregivers and the family members so they can use that in place of me not being there.
And I'm sure Dorothy loves walking around the house. You have a beautiful home.
Thank you.
You're welcome.
So that was really interesting, Dana.
Yes,
I'm glad
yes,
you came
yes,
by.
yes. I'm so glad, because I think a lot of times people think physical therapy, but they don't actually understand physical therapy and all the components that go into an actual physical therapy visit.
Yeah.
Your mom may not be able to do all the exercises that we would want her to do, but just walking around the house seems to be enough for her to keep her mobile, keep her agile.
And what's nice is, as we stand outside, we built this last year for just the purpose of bringing Mom back in and out of the house on wheelchair. And today, because of physical therapy, she will actually get on her walker with the assistance of the therapist or the aide, and she'll actually be able, we're going to do the walk that she does. She'll be actually able to walk over 250 feet.
Wow, that's
and
amazing.
That's for somebody who is in really late stage dementia, who a lot of people would be just bedbound at this point. So if you look, you can see that she's coming from all the way there and has made it with my father and the aide tailing almost halfway around the block.
She was telling me before, I said, "Oh, do you enjoy your walks with John?" She goes, "Yes, I'm going outside."
Right.
So she wants to come outside, and
She
just but even like some of the exercises that he's showing the caregiver to do when he's not here, it's just so important.
Absolutely.
So I'm so appreciative of you letting us and your viewers into the home, just so that they can see an actual physical therapy treatment.
Anytime.
So that's our visit at home physical therapy. If you have any questions or you just have some information that you would like to share, email me at info@allthingshomecare.org. Welcome back to All Things Home Care with Dana Arnone. In today's show, we address physical therapy for older adults. Next, we meet Dolores, who is a cute little 80-year-old active senior, and her physical therapist to discuss how her sessions help her maintain her active lifestyle. And Dolores still works. Today we are out and about, and we are at Farmingdale Physical Therapy West. And I'm here with Matt, who's one of the physical therapists. You're a doctor of physical therapy.
That's right.
And we're going to be doing some exercises and just going over some things that maybe some of your patients experience here at the clinic, and maybe comparing a little bit of what they do at home versus what they can do in a clinic. So Matt, can you tell us a little bit about the clinic here and what you guys do?
Of course. We're an outpatient clinic. We see a lot of patients with musculoskeletal orthopedic conditions, some neurological patients, some chronic long-term pain, and we also have a lot of home cares that we end up seeing as well.
So you see patients in the home, I guess once they become a little bit more mobile, maybe not homebound, then they can come here.
That's right.
It makes perfect sense. So why don't we talk about a little bit what's the difference between a home care patient versus a patient that might be coming to your clinic here?
Of course, yeah. So the benefit of home care is that we are able to mimic the environment they're going to be in the most. Getting up and down out of their own bed, up and down out of their own stairs, into their own bathtub, things like that, showering. And obviously that's a lot more important to some patients because they want to be able to get around their home.
So when they come here, your focus is more on what?
Strength, flexibility,
Okay.
things that are very general versus things that are very specific.
Okay, so would this be something that you would use for them to do
It would
that?
be. Yeah, I'd say, Dana, for you, it's more for comfort right
Oh,
now
comfort.
than anything.
Okay, well, we
Yeah.
discussed my legs, so that's good. And so in here, this is something that you would put the patient on, so they would have to obviously be able to get up here by themselves?
Of course, yeah. Obviously, we have stools available for some of our less height-abled patients. Some folks are a little bit shorter,
And
things
what
like that.
what kind of diagnosis would someone need this for? So would you focus on someone probably with a stroke or a Parkinson's, Parkinson's, or like what would this benefit? So what type of patient?
Definitely more for someone with an orthopedic issue, some chronic pain, whether it's someone who had a knee replacement, somebody with chronic back pain. They do very well in this position.
So when someone comes in, why don't we just tell people exactly what happens?
Sure. Well, they'll come in, they'll talk to the front desk. The front desk will get all their medical insurance, all their prescriptions, things they might need from doctors. We do have direct access, so folks don't necessarily need a prescription, but it depends on insurance. And then from there, we'll take them back, we'll do our initial examination, and then from there, we'll set up a good program, get a prognosis in of how many days a week, and then we'll go from there.
What does direct access mean?
That's just a term that we like to use in terms of that there's no prescription from a doctor. They come right to us. They don't even talk to their doctor. They just say, hey, I'm having an issue with my knee. Do you think you can help me out?
Being that you see patients both in their home and you treat them in the home and you do that here, what do you see as the core difference between your patients? Like who would benefit more from home versus here?
Somebody who can't really get around well on their own wouldn't be safe to come into the clinic. So that's why we offer the home care option. We come to you. And then we kind of work with you there, and then once you're strong enough, able to get up and maybe even drive your own car to the clinic, that's when we have them come in. Obviously, switching from a home care to an outpatient, they might need a new script. They might need a different recommendation from their doctor just to make sure they get coverage from insurance.
But so it's usually 2 to 3 times in the home.
That's about it.
And
yeah.
same here?
Yeah, that's a good average.
Okay.
Depends on the patient, but 2 to 3 is about an average.
So being where I saw when we were coming in, do they have to be able to walk in here?
Yes.
So no wheelchairs?
Yeah. No, wheelchairs are acceptable depending on the patient. Obviously, we want them to be as independent as possible and as mobile before we get them in the clinic.
Okay.
Because, working with a couple folks at a time, you might have a little bit more independence going through your own exercises.
Do you find the same relative outcomes here for people?
So in the home, they might have a different subset of criteria, being able to get up and down off the toilet, out of bed independently. Versus here, they might be saying, okay, we want to make sure they have 120 degrees of range of motion, or 0 degrees down to getting the knee straight, things like that. So the goals, the outcomes are different, but similar. Yeah.
And what was going on during the pandemic? Were you guys open? Were you guys closed? Were you seeing more patients in the home?
Right. Yeah, we're definitely seeing more home cares. We tried to get that a little bit more, the ball rolling there, because we were so limited in terms of how many folks we could have come in, just based on general guidelines from the state. So we were still open, but we were very limited in how many patients we could see at once.
That's great.
So that was the benefit of the home care.
Well, I'm a big fan of physical therapy. We refer all the time because I think that even just having maintenance physical therapy, just keeping someone up and moving around, just reminding them to get up and walk around the house a few times, any type of physical therapy or activity for an elderly person is so important. So I think this is another good option for them. Now we're going to meet Dolores, who's a patient here at Farmingdale Physical Therapy West.
I needed physical therapy because of my back, my sciatic, and I had knee replacement.
So how often do you come?
I come here about 4 times a week.
Oh, okay. And for about how long have you been coming now?
3.5 years to 4.
Is that a normal time frame for patients to come, Sean?
Depending on conditions and also whether we're doing rehabilitative, trying to get people back to a prior level of function, or we're also doing maintenance care, which is partial on both sides right now.
So when you first came, what kind of exercises were they doing with you?
They put the heat on me. They, the massage. My legs, they're trying to lift up, because I couldn't even move my leg.
They put that machine on you?
Yeah. Excuse me. I couldn't move my leg. I was in agony.
And it's been able to get you up and working?
Well, I'll tell you the truth. I had the sciatic when I was coming to work. I forced myself, and I said to myself, well, I'm coming up here. I had enough of this, I said.
It's great.
So I came up here, and they worked on me, and in about a week, I was doing well. But it took me about 3 or 4 months I had this. I didn't want to come up to physical therapy. I figured, but you know what? I looked in the mirror and I said to myself, what the heck am I doing? I'm going to throw away the old Dolores and be the new one and start doing what I'm supposed to be doing with physical therapy. And this helped me.
That's been the answer for you for keeping your youthful appearance?
Not only that, eat the right kinds of food.
Okay.
You keep your stress level down. Don't let anything bother you because, and don't bring any past with you. Leave it behind.
You gotta let that go.
You gotta let it go.
Let it go.
And you still work it.
And I'm still working.
I think that's really what it is. I have to tell you that keeping your
is.
mind occupied
That's right.
is really what is going to keep you young. All this other stuff too.
Yes.
So Sean, based on what Dolores is telling us, is she like your normal, typical patient that you see around 80 years old?
Because she has such an active lifestyle and is working and is actually taking care of friends and is participating in her community, she's really at the top of folks in this area. But as she said, one of the things we see is active lifestyle. We have patients who come in here who are in their mid-90s, and as long as they can get in here before we transform over to home care, it's about keeping going, right, Dolores?
Absolutely.
So what would you have? Would you have a suggestion for anybody that's viewing right now on, what if they're afraid to go to physical therapy? What would you say to them?
Don't be afraid to go to physical therapy because they are there to help you. One good thing is look in the mirror and say, what am I doing? Why am I in such pain? How can I be helped? Well, you say to yourself, I'm going to throw away this me and become a new person.
That whole mindset is really what helps people. And coming to physical therapy, I know some people are a little afraid, they're a little timid of the machines that we're going to hopefully get to. Really helped keep you mobile and kept you're employed. Well, thanks, Dolores. Thank you, Sean. You gave us so much information, and it was a pleasure meeting you. I'm sure that you touched a lot of people out there.
I hope
and
so.
I hope that they come and follow your example, because you're a perfect example. Welcome back to All Things Home Care with Dana Arnone. It's time for Ask Dana. Our first question comes to us today is, what is physical therapy? Well, physical therapy helps people recover from surgery, an accident, or an injury. Physical therapy helps when the body is changing in a way that is affecting function and quality of life. A physical therapist evaluates a person from the standpoint of their mobility, balance, and strength. What are they having difficulty doing? What do they want to get back to doing? The basic premise of physical therapy is that you're looking at a person's physical dysfunction and determining the steps to take in order to improve the person's physical condition. Our next question is, what happens in a therapy session? Well, there's always that element of a patient's education to help people discover what they're doing on a daily basis that could be contributing to their problem. The physical therapist may need to re-educate a person on lifting something correctly or moving properly. During a PT session, the therapist usually applies hands-on techniques such as joint mobilization for a stiff joint or soft tissue work of stretching or massaging tight muscles. Some physical therapists also do manual manipulation, which uses careful, directed manual force to improve mobility in joints, connective tissues, or skeletal muscles. Physical therapy always involves exercises of some sort, from a low-level stretch all the way to a well-rounded strengthening program. Physical therapy modalities are rehabilitation technologies that relieve pain, reduce swelling, decrease muscle spasms, and improve circulation. These modalities include ultrasound, trigger point pressure, dry needling, soft tissue oscillation, electrical stimulation, traction, biofeedback, heat, and ice. The exercise prescription and hands-on techniques are central to each PT session. Our next question, why do I do these exercises? Some of them make me sore. While physical therapists sometimes push people beyond their limit or comfort zone a little bit, encouraging them to go beyond what they think that they can do. Physical therapists try to look at things objectively and implement different tests with patients. We try to empower people to kind of fix themselves. We don't want them to have to keep coming back for more. Ultimately, we're trying to get people to a point where they can maintain themselves and do their exercises at home or at the gym and go on with their lives. Physical therapists push people so that they can be as independent and not reliant on others, medications, or other treatments. So next question, why do physical therapy take longer than I had thought? Well, physical therapy is not a quick fix. Americans in general are notorious for looking for that quick fix. Physical therapy follows the way our anatomy and bodies operate. There's a certain amount of time that is required for certain types of tissues in the body to repair themselves. If you speed up the process, you could experience a re-injury. So physical therapy takes time, patience, and perseverance, and you've got to keep up with the program to experience the gains. Physical therapy recovers in stages, and you have to be present for the whole program from beginning to end if you want the lasting results. Do I really have to go do home exercises? Well, oftentimes people go to therapy only 2 to 3 times a week, depending on their insurance and payment options. The responsibility for improvement falls upon the individual, too. The stretching and strengthening exercises are really something that has to be done almost daily. You're not going to get the progress or improvement you need just relying on going to your physical therapy visits, so you have to do exercises at home. And by the way, we can always tell if someone's not being good about doing his or her exercises program or not. Well, that's all the time we have today. Please email any of your questions to info@allthingshomecare.org. Welcome back to All Things Home Care with Dana Arnone. In today's show, we address physical therapy for older adults. Let's go back into Farmingdale Physical Therapy West to see some different tools and techniques used at their clinic. We are now in the actual space of where people do their physical therapy, and Sean's going to take us on a small little tour of exactly what type of equipment you can expect to see here if you were to come to this clinic here. So Sean, why don't we take a tour of your most common, the most used type of items that someone would be coming here to use.
Absolutely. So first of all, behind you, which we can't show because we have patients, are the tables where we're actually doing our manual soft tissue mobilization and neuromuscular reeducation. But if you start looking this way, you could start seeing some of the basic equipment that we have, like the Precor, as well as our treadmill, a standard treadmill, and over here as well, another Precor and a recumbent bike, all part of therapy plan of cares, depending on what the condition is. Over here, we actually have our gym equipment. This is probably the most used piece, from the leg press to the chest press, as well as also using some different wire cable solutions. That also relates to folks' physical therapy. Coming over to here, we have one of my favorite spots, which is our stretchy band area. This is for step-ups, not only for vestibular and balance cases, but also here we start using different strengths. Each one of these colors corresponds to a different essential pressure or weight amount.
So is this hard? Can I see?
Go for it. So what I want you to do is, if you come back, stand over here on this line.
Okay.
Okay, now you can pull this down to a right angle.
Is this,
There you go.
how?
Now, you see that resistance?
Hercules.
Okay, now we're going to try another resistance. Tell me if you feel a difference.
Okay. Oh, I like this one.
Yeah, right?
This is better. So where do people start here and they work their way there?
Exactly.
Okay, that
exactly.
looks nice.
And this is much more of a functional type of therapy to build up or to rebuild muscle.
Okay.
Now, the crown jewel, if we keep going through, is our ultra-gravity treadmill.
Yeah, I'm sure not a lot of places have this, Sean.
Essentially what happens with the ultra-gravity treadmill is we put someone into pants, specific pants, and they go into the treadmill itself. We zip them up, we turn the machine on, which actually forces air into into this section, which is airtight. It gets zipped up, and that is going to be creating essentially a vacuum. In that vacuum, we can go ahead and adjust, depending on what type of therapy we're going for, percentage of weight. So if my weight is 180 pounds, we can get me down to what would be the equivalent of 18 pounds. And then I could go for a walk, I could go for a run, and I would only be putting on my joints, my knee, only my ankles, only 18 pounds of pressure. So everything from student athletes who are going through injuries, rehabilitations, ACLs, ankles, through runners, up and through our seniors, especially folks with Parkinson's, folks who just need to get in with any sort of degenerative progressive disease, who want to be able to get back on their feet. Bingo. We've had folks come in who are training for marathons who've been on it for an hour and a half. So it really depends on what the program is.
Love it. And then you have weights over here. I see
Correct.
some weights,
So
like
over
your
here,
typical weights.
We have just some Cybex machines, hip adductor, and again, this is more of the leg section over here. also just your standard dumbbells and your kettlebells as well.
Well, I think it gives people a good idea of the options and the different types of therapy that you receive when you go outpatient versus in-home services. So this definitely is very good. I wish that they could see what we can see right now, but every table is full, which speaks a lot about your practice. And you know, if there's anybody has a question, Sean, if they want to come down and take a look, or maybe have some therapy here, how could they reach you guys?
You can reach us on our website at farmingdalephysicaltherapywest.com. Our telephone number is 516-731-3583.
Well, I thank you very much for your time and the tour of your beautiful location. If you have any questions or if you want to check them out, you can visit our website at allthingshomecare.org. Well, that's all we have on our episode on physical therapy for older adults today. If you or someone you know needs assistance, you can find their numbers and links to today's guests on our website at allthingshomecare.org. Please follow us on Facebook and Instagram. We'll see you next time.
All Things Home Care elevates and supports home health caregivers by providing transportation and promoting education to better care for homebound seniors and the disabled. To find out more or to make a donation, visit us at allthingshomecare.org.